keloid. How to go about a keloid? Keloid 1, it can be autosomal dominant, it can be due to alpha D3 collagenase enzyme defect, or it can be after a trauma. How do we go about a keloid? The most difficult treatment in a skin condition is going to be this keloid management. Routinely we used to go in for IL steroids. Yes, good. What I advise is, first stage of treatment will be IL steroids with cryo. Without cryo, you just go in for IL steroids, definitely it will recur. So, IL steroids with cryo. The sensitivity of fibroblast is in and around -40 to -80. By a spray method, we attain a temperature of -80. That will be helpful. Fibroblast never goes in for a recurrent collagen formation. The fibroblast has to be controlled, otherwise there is going to be recurrence. So give an intravitreal steroid, immediately you can go in for a cryo. Second type of treatment, if at all this does not respond, what now we are trying is something like 5-FU in vitiligo. We apply 5-FU over the keloid and just insert it with a needle, commonly insulin needle, leave it for 15 days and then go in for the second dose, second scheduled. 30 to 40% of keloids respond nicely to 5-FU, because as you know, 5-FU has a potency of even killing the cancer cells. The only thing, a topical 5-FU without penetration is not going to act, since it's a hard tissue. So, insert this 5-fluorouracil inside. Third one, you don't get a response for 5-fluorouracil. Then we can go in for carbon dioxide laser. Burn the lesion, give a gap of 15 days, again you can go in for second sitting. If the response is good, proceed. If the response is not good, turn to again IL steroid. Because keloids, as I told you, the most difficult part of the treatment, most difficult disease to treat. If it responds nicely with the steroids and cryo, good. Not with that, then move on to 5-FU with needle penetration. If it does not respond, then we can go in for carbon dioxide laser. One and all, the results will be 40 to 50% with IL steroids. This is my experience. 60 to 70% with 5-FU and again 60% with carbon dioxide. So we have to tell the patient that we are trying to help, we will help, but according to the skin type, the result varies. Be guarded in your words. Don't tell them that there will be a positive result in anything. Cosmetology, whether it is Botox, whether it is fillers or anything, the remedy will be for only 6 months. After 6 months, again we are going to go to number 1. Tell the patient that it's all temporary. A very good aspect of these things is, once we tell it to be temporary, the complications are also going to be temporary. So we can be very happy about that. You end up with a drooping, you end up with a lid lag, don't worry. Everything is going to go off within 4 to 5 months. Now, I am just going to start IL steroids with cryo. That will be the first method. Second thing will be, the only thing, inject it into the material, into the keloid, don't go below, then you will end up with steroid complication, right? This is IL steroid. Combine it with cryo. The only thing what we have to do, we have to use an antibiotic ointment or a steroid ointment, any bland ointment around the keloid before going in for a cryo. Otherwise we will end up with post-inflammatory depigmentation, because melanocytes are the most